Hello, I'm Tim Weaving, a PhD student at University College London, and I'm pleased to welcome you all to the 19th instalment in Comp Biomed's e-seminar series in collaboration with the Virtual Physiological Human Institute, or VPHI. Today's session will be slightly different to those that we've had previously, as we have not one, but two speakers, both on the topic of biomedical supercomputing applications. The first talk shall be given by Mariano Vasquez, who will introduce the biomedical context before Guillaume Houzeau gives his talk on parallelization, performance issues, and enhancement. After each of today's talk, there will be separate Q&A sessions, so please save your questions until then. Once the talk is finished, you can post your questions in the questions tab, and I will read them out to the respective speakers to keep the session running smoothly. Now, first up, we have Mariano Vasquez, a researcher at the Barcelona Supercomputing Center, BSC, where he has co-led the ALIA project since 2005. He is also Chief Science and Technology Officer of LM Biotech, a BSC spin-off company whose mission is in speeding up the technology transfer from BSC to the biomedical domain, putting supercomputer-based tools in the hands of those who need them to improve healthcare. His main research interests fall within areas of computational science, such as computational biomechanics at the organ and system levels. In this first talk, Mariano will discuss organ-level simulations and virtual patient modeling for precision medicine, which represents the ultimate example of supercomputing in multiphysics, multiscale modeling problems. Now, before we begin, I'd like to briefly remind you that the session is being recorded and will be available on the Comp Biomed website and YouTube channel shortly. So please do use this to go back over parts of today's talk and others in the series, maybe even share these e-seminars with your friends and colleagues. Now that's everything from me, at least for the first half of today's e-seminar, so I very much hope that you enjoy these talks, and without further ado, I'm going to hand over to you, Mariano.
Thank you very much, Tim. Thanks a lot, Tim and Gavin, for organizing this talk. I am really very pleased. Well, this is the purpose of my talk is to, as Tim said, is to describe a bit the kind of things that we're doing. This talk is going to be complementary with that of Guillaume that comes later, in which he's going to show at what extent what are the things that we do in order to achieve these results that I will show now. Well, first a bit of I will give you a brief panorama, which I describe on like a pyramid with different layers of the institution in which we are working. So at the lowest layer, you have Mare Nostrum 4, which is this very large computer in Barcelona. It's more than 150,000 cores. It's one of the largest in Europe, but what is interesting also is that this is the 4th edition and we are moving to the 5th one. So the procurement is already done and the computer is being built. So we hope that next year we will have this Mare Nostrum 5 working, which will be about 10 times larger than this one. We work on hardware, software and data. So at the next layer is Barcelona Supercomputing Center, which is hosting this computer. So BSC is located in Barcelona. We are more than 600 researchers. It's a Spanish public center, research center. It's we've been doing applied computational science since 2005, in which was created. This is the picture. You see our new building, which was finished a few months ago in Barcelona, in the upper part of the city. Then at the next layer of the pyramid, smaller, it is kind of a bit less than 10% of the researchers of the institutes are researchers in our team, in the ALIA development team, led by myself and Guillaume. We are kind of 50 researchers of different kinds, mathematicians, physicists, engineers, programmers, of different kind at different levels, senior and PhD students. It was born at the same time in 2005. We started being 2. Now we are kind of 50. So we are, well, we've grown pretty much. And at the very top of the pyramid, there is a startup. It's a spin-off company from BSC, which was created to convey the technology that we developed and put it in the hands of those that really need it. This is for the vertical in biomedical, in the biomedical realm. I will talk a bit later about what we do in the company, but most of the examples are related to the company and can be bought, let's say, through the company. The technical challenge is to recreate biological systems in a computer. Now, the more complex the system, the larger the computer you need. But the problem is that in order to take the most of the computer, you need an efficient code. So the larger the computer you are using, the more efficient the code must be. This will be in this talk. I will give you some applications example, and in the next talk, Guillaume is going to focus in the third row of this slide. A bit of a background. This is ALIA. Is the name of the code. It's a parallel multiscale simulation code. It is used in different verticals, like related mostly to industry, like aerospace, energy, environment, and biomedical. In being promoted by Biomed, these two seminars are going to be related to these applications, the biomedical one. It is important to say that ALIA is the only multiphysics multiscale code for biomedical use at organ level that was born and developed in a supercomputing center. This means that we are not smarter than others, but the fact that the code was born and being developed in a supercomputing center just explain why we need everything that we do must run efficiently in the computers, and we struggle to make these more and more efficient time after time. The concept of the code is for high performance computing based simulation for supercomputers. I'm not saying that every simulation must run in a supercomputer for this industrial or any industrial domain. What I'm saying is that if there are plenty of things that you don't need a supercomputer to do, but for the cases in which you need a supercomputer, there we are, and there is ALIA working. It's for coupled multiphysics and multiscale also. We do things in order not to, even the individual problems can run efficiently, but the goal is to make that the coupled problem run efficiently. Typically, these are large-scale problems for complex cases, and the use is to analyze, understand, improve, but above all to predict the behavior of different physical systems. Typically, the keywords of the kind of things that we do with our code are complex and conventional physical and mathematical models, typically things that you cannot do with commercial codes. Pre-process is usually very complex with large meshes and complex geometries. Post-process is also a complex one. All that means visualization and analysis of what we do is also complex, because of the sizes, the problem mostly. There is then a lot of big data management and visualization. I will talk about a bit the kind of big data management that we are talking about when I talk about this. And finally, what we do is efficient. We must do not just efficient, but also accurate software for supercomputers. We started as a game by giving colors to the different verticals. And for the biomedical vertical, everything that in which we use ALIA, we call it ALIA Red. So these are simulation tools for biomedical, ALIA Red. Is for and what we do are in silico clinical trials and diagnose. It's for organ and tissue level, nothing molecular. It's for complex problems in which require supercomputers. As I said before, we started working with cardiovascular, respiratory, but we are doing other things. In the company, we are very focused on cardiovascular, but respiratory is working a lot. The users of this kind of technology are typically, apart from academia, are typically pharmaceutical industry, medtech industry, clinical research, contract research organizations like CROs, regulatory bodies, hospitals, different players. Well, an engineering designed material, typically like metals, plastic, or rubber, works more or less like this. But the complexity in the biomedical realms come from this point, that biological tissue is not working in such an ordered way. It works in a way more like a team with very strong characters of the individuals that must work just following a goal. So it is typically multiscale. So every scale has an influence. It is multiphysics. It's coupled in a very large complexity. And what is very important is that you can see these emergent macroscopic properties coming from the different lower levels. The scale span is really very large. If you think about molecule and you think about the healthcare organization, you have kind of 12 orders of magnitude from one to the other. So it is impossible that you solve everything. But you have to take into account these very low levels because they in biological systems, they decisively influence the high levels. So I'm not meaning that you need to solve all levels, but you have to take into account these multi-level or multi-scale influences. You cannot forget about them. You are not going to model everything, but you have to think about them and do something in order to take them into account. If you want, even if you want to remain in the central part, you have to take into account what is coming from the upper and from the lower levels. You have heard about the American FDA, Food and Drug Administration. So they had a vision on the regulatory process. This is they did this in a talk for medical devices, but it can be applied to pharmaceutical. What they do is that until now, every time that a medical device must pass a regulatory process, you have these three large tests that you have to perform on your products: laboratory, human, and animal tests. And there is this small computer things that you have to do. But their vision is these things are changing very rapidly. So now you will have you have less laboratory, human, and animal tests, but now the computer ones are really getting larger and larger, more important. But it appears this new kid on the block, this virtual patient. So this virtual patient really is an explosive complexity boost, because for the virtual patient, you have to model not just the isolated therapy, but do it on the patient. So you have to model not just, for instance, if you think about the stent, a stent is done with a biomaterial. You don't have to model just the stent contracting and expanding. You have to model the stent contracting and expanding in the patient. So you need to take into account the system, the organ, the tissue level. You have to model them. This implies a kind of comprehensive modeling in which you take into account many physics and many scales, but also you have to take into account the variability of the patients, like comorbidities, the variability of the patients within the same species and different ones, etc. And this, of course, requires a specific in vivo and experimental validation. We can have a complete series of talks about this. It's a very complex problem. The important thing here is that it is not like the typical engineering validation process. This must be done in what they call context of use, but it is very different one and very, very complex. So just a couple of examples to motivate the idea. I will start by the cardiovascular system. Just this first slide shows the state of the situation. So here you have this. We have all these collaborators. It is not important who are they, but what is important is the kind of collaborators. So you can see here that you have academia, companies, hospitals, research centers from Biomedical. So it is indeed a very varied environment in which we are working in which the doctors are those that leading and posing the questions, and then we are here to solve the problems. From an engineering point of view, the heart is a complex coupled multiphysics multi-scale problem. On one end, you have the electrophysiology, which is modeled by it's a diffusion equation with some nonlinear terms at the right-hand side, which is called, well, the cellular model and the tissue model. Cellular model is this, which is called the O'Hara-Rudy model, which is the dynamics of the electrophysiology at cell level. So there are kind of, in the right-hand side of these equations, you have sort of 50 ODs that are solved at each time step. Then as this propagates is coupled with the mechanics, with the mechanical contraction, in which you solve a typical nonlinear transient solid mechanics problem for large strains. Electrophysiology and mechanics are coupled through this electromechanical coupling, which is not, it is done at each at volume level. So at each point you have this coupling. This coupling does not present, it's not complex from the numerical point of view. It's relatively simple, but it is complex on the physiological point of view. So there are different models that can take into account different aspects of the physiology of the problem. And then if you keep on coupling, you have the blood flow that goes inside the ventricles. So this blood flow is typically, we use Newtonian fluids, can be non-Newtonian, but is for very specific problems. In this case, what I will show are typically Newtonian fluid mechanics. And it's again also a transient, like the three problems, it's a transient nonlinear. Solves using the typical incompressible Navier-Stokes equations. The coupling between the mechanics and the blood flow is more complex from the is done at surface level, is more complex from the implementation and purely computational point of view, and especially for the parallelization also with some very interesting aspects. But it is not, from the physiological point of view, is not at all controversial. It's the typical forces coupling. Now, if you think about the differences with an engineering problem like the I don't know, the fluid around an aircraft, is that, as we like to say, nature is not a CAD user. So you don't have the, when you are born, you do not come with your CAD description. So you have to do something in order to create the anatomy, to create a scenario for the simulation, from the anatomy to include everything that is relevant on the anatomical and physiological description of the system that you're solving. Then the analysis of the results is also a special one, because you cannot measure, I don't know, pressure or velocity everywhere you want. You cannot put a strain gauge it is not like putting a strain gauge in a wing or doing PAV wherever you want. Is much more difficult, many times indirect, with scarce experimental evidence, and very difficult to set up. And sometimes it's really impossible to set up an experiment to measure what you would like to have, which means that validation and verification is very difficult too, and it's a very complex problem. To make things more complex, it is important it is not just a blind simulation. You need to establish very well the context of use, which is what you are doing, and the questions of interest, which is what you want to measure and what you want to validate. So it is not like modeling and then, well, you can have whatever you want and this is fine. No, it's much more complex than that. So this is kind of the full panorama of the sort of things that I will show you here. Typically, what we do is we have a patient's database of female, male, and children. In this case, this is done with one of our collaborators, the Visible Heart Lab at the University of Minnesota, with about almost 100 different hearts taken from explanted hearts. So these people is not living. This is very interesting because it's people that died donating their bodies to science. So what they do is they explant the heart and have kind of a statistically, I wouldn't say meaningful, but statistical distribution of hearts in the US. So about 100 of these hearts. Now what we do is that for each of these hearts, with these hearts, we can do kind of a continuum morphing, physiologically meaningful between one and the other geometry, and with that we create a virtual patients database. of female, male, and children to study the hearts in health, disease, and treatment. What this is in this slide, you can see why do we need high performance computing, because each of these hearts that you see here represent one individual. Each of these hearts must be solved using a parallel complex run with eventually 100 millions of elements in it. But you don't want to solve one. You want to solve thousands of them. Then you see what is at what extent the value of high performance computing is in this field. Not just to solving one. You don't want to run one heroic simulation and then write the paper. No, you want to run many of them. What I am meaning, well, you see this in this this slide show the full complexity of the model. So this is a heart. In this case here, in the central part, you see the control heart, so it is a healthy one. So here you see the ventricles that are colored by the electrical activation, which propagates and makes the heart to contract. And then these ventricles are acting against the fluid mechanics and pumping in and out the blood. Here it's ventricles are only active. The atria are there just for mechanical purposes. They are not active. And this is we are interested only in the systole moment, in the moment that the ventricles are contracting and expelling out the blood. To the right of your screen, you see the heart, in which we have produced a disease, which is called the left bundle branch block, in which both ventricles are not activated at the same time, so it produces a large desynchrony. And what we have done is we have put to the very right, we have put a pacemaker to try to recover the cardiac function. So you can see in the table the different biomarkers. What they call biomarkers are the things that you can measure that can lead to a biological interpretation of the condition of the patient. So biomarkers are, for instance, left ventricle ejection fraction or left ventricle end of systole volume. And what we do is we place the pacemaker somewhere in a very similar way that the doctor does, just choosing the place where you put your pacemaker and choosing also the synchronization of the pacemaker with respect to the rest of the heart. And we change this synchronization and this placement in order to see if we can recover this cardiac function. This is another beautiful example. This is a different pacemaker, a different kind, much more sophisticated. It's called, there is a model, this is produced by only one company, which is called Micra. The company is called Medtronic and the pacemaker is called Micra. So here the pacemaker is this small gadget that goes pinned in the right ventricle. It's small, but it's not that small. As you see, if you compare with the ventricle, it's relatively large. So to the top of the slide, you see the stress is produced inside the muscle. Then that's why this is in the full meaning of what I said before about that you need to model the tissue and the action of all the as a biological system. Then in the bottom of the slide, what we are studying is the action of the fluid mechanics around this pacemaker, the Micra. Because what the collaborator wanted to study in this case was the forces of the fluid mechanics in the Micra, because you don't want that this pacemaker get loose on your system, so it must be very tightly pinned to the ventricle. So this is to study the forces at the anchoring system, also to study how this thing perturbs or produce different flow features. What you don't want in this case is you don't want that this thing can produce in your ventricles some strange flow features that can lead to thrombus formation. So this is something that can be studied, at what extent this is producing thrombus or not. And finally, what they want to know here is where to put the pacemaker in order to recover the cardiac function, like in the other one. This is another example in which you see the patients clearly. This is something that we are doing with a hospital here in Barcelona, which is called the Sant Pau Hospital. It's a clinical validation study. So in this case, it's statistics. We have 20. We have information of 20 patients, real ones, that can be expanded to about 400 virtual patients by changing some of the features of the different patients. We have the information just before. We have information before the pacemaker implantation and after the pacemaker implantation, and we use this information to validate what we are doing, to compare and see that we are doing things properly. This is study for the what the doctors call acute scenario. Acute scenario means in the right before and after the pacemaker implantation, and we can study many biomarkers. Some of them can be compared with the doctors can obtain from images. Because this is important, is that these are not explanted hearts. So these are real patients. So you need to create the simulation scenario from images, from magnetic resonances, from echography, from TACs, CT scans. And you can analyze different biomarkers like the length of the electrical activity, which is called QRS, the morphology of the electrocardiogram, the ejection fraction, different things related to electrical activity and to mechanical activity. And with that, you try to, at some point, validate what you're doing. This is another, is different. In this case, we are coming back to fluid mechanics. In this case, is there is a device which is called ventricular assist device, which is a pump that they put in some hearts. These are people with very grave disease, in which a very advanced heart failure. So they are waiting for a cardiac transplant. In this case, the pump is the heart works very badly, and what they do is they insert a cannula, which is continuously pumping blood inside and out of the heart, and then moving this blood directly to the aorta, pumping the blood directly to the aorta. So what is interesting here is, again, at what extent the necessity of HPC is important. To the right, top right, you see the sensitivity matrix of the properties of the heart as varying some of the parameters of the pump, of the patient, different parameters. And what we're seeing is the changes in the inputs the changes in the biomarkers, which are the outputs, with respect to the changes in the inputs. Every point of this, every dot of this graph represents a patient. Every dot of this graph represents a simulation like the one you are doing to the left. And every point of this, every dot in this table, in this graph, represents a HPC problem of a heart solved. In this case, it's kind of 500 cores, each of these dots. So here you see the large need for HPC usage, and how you need an efficient code, but also an efficient way of dealing with all this simulation and all this data. Another one, a different problem. In this case, this is a bioprosthetic valve. These are the typical, when people have especially with aged people, when they start having problems, they start to have this, what can come is that the valves are calcified and are not working well. So what the doctors do is that they deployed an artificial valve. So what we are simulating here is this artificial valve. And we're studying the features, the flow features downwind of these valves. The two in the movie you see to the left and to the right in producing these kind of worms that these are the Q criterion. Is a way of studying the vortices that are produced in the flow. The one to the left is stiffer, the one to the right is softer, and the real ones are more or less in between. So again, patients everywhere. So changes in the inputs of the valve to study different properties. In this case, what we like in the case before, there is something that it is today is kind of a la mode, which is to study the thrombogenicity, the potential for producing thrombus, because everything alien that you do in your body, which is not natural, can produce thrombus, can produce stagnation points of the blood, can produce weird flow patterns in which the thrombus can generate. So this is the goal, to study biomarkers, the biomarkers that at some extent can predict the thrombus formation. This is a different one, in which what we want to study is not the efficacy, but to study the safety of a therapy. In this case, is the drugs. Very likely you have heard about what happened at the beginning of the COVID pandemic, in which people started to, the doctors started to prescribe drugs for healing, not vaccines, but drugs for try to heal the COVID. In this case, the typical drugs were azithromycin, hydroxychloroquine, chloroquine. So what we have done is we perform a study using the same model, because the model can cope with this. We perform a study on to assess the cardiac risk, the potential for producing arrhythmias of different drugs. So we create a population using our database. We create a female population and a male population distributed in a way, changing some parameters in order to produce the population with a statistically meaningful idea. And we create this 64 population, and we run different conditions in a stress test to identify the arrhythmia, or in resting condition to study the morphology of the electrocardiogram. We see these sort of things. This is an arrhythmia that is produced. These arrhythmias are kind of turbulent behavior of the electrical activation. This arrhythmia is produced by the administration of one of these drugs, hydroxychloroquine, which produce this very weird behavior. So these can be very dangerous arrhythmias, and they're really very, very dangerous. And what we are doing, we're studying this again, this population. These are larger problems because, the resolution of the problems is smaller. So these are larger problems, very complex ones. And here again, population. So you see clearly the usage of HPC. If you really want that someone if you want to that those that really need these tools can put their hands in them, you need to create this user interface. So this is done not by the center, this is done by the company. What we are doing is to develop in a graphical user interface, trying to strip as much as possible the computational complexity, because this is going to be used by engineers or doctors. So you need to have all the physiological or anatomical complexity, but no computational complexity. And this tool is not just to set up a run. This tool is to set up a population run. So you need to create your population with this tool, and then submit and then just start the trial. For those that have some experience or have heard about it, this is very, very similar to what a real clinical trial does. In a real clinical trial, what the companies are doing they are creating a cohort of patients, gathering a cohort of patients and trying and testing the treatment on them. So this is the same thing, but in this case, the cohort are not real patients, but are virtual patients, which are these sort of digital avatars of people, male, female, children, and running the case in these avatars. Now, the analysis of this, it is not just the typical analysis of one case. It's an analysis of one case, each of them, if you want, but also a statistical one. So you need these very special ways of analyzing things, very similar to what is done in a real one. So the program is deployed in a cloud, in a high performance cloud, in which you can have these high performance instances. This is not all the commercial providers can have these kind of instances. So you have your code is deployed in the cloud, and it is managed by a backend and accessed through a front end. And then through this front end, you can set up the the clinical trial, and then you can analyze the clinical trial as things happen. It is important also to say that this is not real time. This is human time, let's say. We are not trying to solve this in real time. We don't want to solve one heartbeat in 1 second. No, but at least if you just think about that, a typical clinical trial with normal people can take kind of 3, 4, 5 years. Then if you can produce something like this in 3, 4, 5 weeks, the customer is absolutely delighted. I will show a couple of examples more just to motivate these from different domains. The first one in respiratory will be only just an example. Again, same thing. At the collaborators, we have every kind of collaborators, not just academia, but of all kinds. So the features of this is not that, from the computational point of view, is not as complex as the other one, as the cardiac. So it is typically computational fluid mechanics, CFD, in large scale meshes, 3D and 1D, and 3D 1D couple also. Also there is particles and Eulerian transport and deposition. Have fluid structure interaction for some kind of problems. We can create these sort of, as you see at the movie, the GIF movie to the right, we can create these synthetic bronchial trees in order to see how the air can get into your systems. So again, as in the other case, there is plenty of not just simulation, but also data analysis. In this movie, what you see is a patient. We have this patient kind of glass in this glassy description. So this we have done this with you see there below the reference. We have done this with some collaborators at Imperial College and some hospital in London, in which we got the description of one patient, and we study the particle deposition map in the system of the patient by changing different things. So we change the different ways of the patient for inhaling and exhaling. We can change the geometry. We can change the sizes of the particles and the mass of the particles, and we can study how the particles are going into the system, are delivered into the system, and where they sit. Depending on the size of the particle, they sit in the upper airways or lower airways. We can study also the flow features and many of the things in the respiratory. We've done many other things in the respiratory, but I wanted to show you just one example to see at what extent this is complex. And my final example is this one. This it's very interesting because it's this Alia Purple, we call it. It's the virtual pregnancy lab. This is something done with Washington University in St. Louis, and it is interesting because the story is very nice. Out of the blue, I received an email from one professor there at this university saying that he has been working also with electrophysiology in the heart, and you know, the heart is a muscle, but also the uterus is a muscle. So he said, I'm sure that you can do the kind of simulations we are looking for without a great change in your software. And indeed, we did it. We ran simulations of the contracting uterus of a woman at the moment of delivery. So that's why this is a kind of a virtual pregnancy lab. We compared also with they had some experimental evidence there at their lab, and given the relative simplification that we have done of some of the aspects of the simulation, the results that we have are really very, very encouraging and very similar to the experiment. So we are very happy with this kind of modeling. So as a sort of a conclusion, I will leave you just one message, is that as I said before in one of the first slides, there is not in biomedical domain, not everything requires large supercomputers, but when you require supercomputers, they are really large. The problems are very complex, not just because of the size of the individual problems, but from the fact that you need to run many of them, because everything is done considering a cohort of patients. So it's done, in this case, is a virtual patient. And why? This is something that is not at all going to change, never. Because for doing these sort of things, you need, if you want to reduce the amount of simulations that you do, you need more data. And you cannot have all the data that you would like to inject in your model. The model is not complex enough and the data you have is scarce. So then you are forced to run many simulations, changing parameters in a meaningful way. So that's the reason why supercomputers in biomedical sector, supercomputers are there to remain, and the usage is going to be larger and larger. And that's it on my side.
Super. Thank you very much, Mariano. Just a quick reminder for the audience, if you have any questions, then please go ahead and write them in the questions tab so that I can read them out for you. So just whilst we wait for the questions to start coming in, I actually have a few for you, Mariano. So this is great. You've shown us some really impressive applications, but how can you assess the precision of these simulations, given that the systems are so complex and the experimental evidence is so scarce?
Yes. It's very difficult. As I said, the problem here is that you cannot measure whatever you want. So most of this validation is done. Well, you have this verification and validation. So first of all, what we do is, like, at the moment that you are programming things, you are always testing against some literature, some evidence that you find in the literature with simple problems. So typically these are done in very academic problems, very simple, not real at all, but at least that can give you a better idea of what you are doing. Then what you do is you try to compare this with, you have two options. If possible, you have two options. One is the experimental way and the other one is the clinical way. In the experimental way, we've been doing this for the VAD, ventricle assist device example, in which what we wanted to do is we wanted to try to reproduce an experiment. So in this case, it wasn't a real heart, it was a silicon heart that was moved in a way, contracted in a controlled way to pump the blood. So in this case, what we are doing, we have more data in this case, because this person, the experimenter in the State University of San Diego, she can measure with PIV the velocity at some places. However, the experiment itself is not like placing a car in a wind tunnel, because we don't have the CAD description. So it is approximately, and it's very similar what happens if you more or less what happens on the other way, which is the clinical one. In the clinical one, you don't have plenty of information. It's very difficult to set up a simulation scenario. The models are very complex. You don't know where to cut the complexity and say, and I will not model this, so I will stop here. So what you do is a kind of validation, which is, in both cases, you do a kind of validation which is done statistically. So you choose very, very, very carefully the parameters the input parameters you change, and you choose very, very carefully how are you going to compare the results with the clinical ones. So again, we can talk about hours. It's indeed a very difficult point.
No, absolutely. Thank you. I mean, you mentioned the clinical setting there. So how far removed is what you've shown us from these real therapies and the real patient?
This is a very important message I wanted to convey, is that in this presentation, you can think about something like it is close to science fiction, because, well, you see these bodies and hearts beating and whatever, and all simulated in large computers. Well, let me tell you that this is not science fiction. This is something that is happening now. In fact, we created a startup, and in fact, we are at this moment we are performing a crowdfunding thing. So it is real, and we are trying to make money of this. It's happening. Doctors are using it. Medical device companies and pharmaceutical companies are using it also, slowly indeed. But they are using it. The regulatory bodies, like especially the FDA, they are encouraging the industries to use these tools. So how close are to the real patients, to you, to me, to those in the audience? Very close. Not yet, but very close. What the patients will see, the first thing that the patients will see is that the treatments are better because of these kind of tools. And the next thing would be, well, now develop a therapy for me. But this will come later. This patient-specific stuff, at least in this domain, is going to come later. So you don't know, maybe 5 or 10 years later. But in any case, the benefits of having better treatments thanks to these kind of tools is something that it is happening right now.
Right, I see. So I'm not seeing any questions coming in from the audience yet. So maybe I'll continue asking you a few. So something that you said was that not all biomedical applications require supercomputing, right? But you said that when supercomputing is required, then it's it's really really required. So to what extent is the exascale needed for such simulations?
Well, if you the exascale is going to be needed at 2 levels. One level is that the individual simulations, maybe we are not going to use we are not going to run one exascale simulation. Every patient is not going to be an exascale simulation. This can be sort of heroic to show something, or to write a paper on the largest cardiovascular run ever done. But this is no more than, I don't know, like a trophy for a gallery. But what will happen is that these large exascale computers are going to be used massively to run many patients at the same time. Each of the patients you can think of each of the patient can be something of the terascale order, let's say, and you are going to use the petascale size of the computer to run one trial. So if you think of the exascale, you will think, well, if you really increase the complexity of the problem, you can move this to petascale and exascale, not terascale and petascale. So this is that's why the exascale is important here.
Sure, I'm with you. So is HPC and exascale candidate modeling, is it everywhere in biomedical research?
Sorry, can you repeat?
So following on from that, is HPC and exascale candidate modeling everywhere in biomedical research? Right.
Yes, absolutely. These are not going to be, of course, these computers are not going to be available in a hospital, but these computers are going to be available remotely and by proxy. Someone that can, the doctor will prescribe some simulations on you in the same way that they prescribe now magnetic resonance. And these simulations are going to be done following some protocols by someone somewhere. And they can come to you, come to the doctor to analyze. Or if you perform an in silico clinical trial, or a company want to improve their things and something like that. So HPC and exascale will be a absolutely key player in the future of healthcare.
Of course, thank you. So just one more question from me. If any, what is the role of artificial intelligence in all of this?
Well, it's the clearest one, the most evident one, is the analysis of all this data that is produced. So you produce from synthetic data, you produce results that can be analyzed. You can use also these to compare with real data in order to improve your simulations. And so the usage of machine learning will be very large on this respect, which is the obvious one. But there is one which is not that obvious, which is when you teach your simulation, your model, when you teach your model, in order to improve the model itself by using let's say physics informed simulations, so or simulations driven by data. So in this case also machine learning, this is more subtle, but especially for multiscale is going to be decisive. So I think that in these two in these two regards, machine learning is going to be decisive also, not per se, but by combining machine learning with modeling and simulation. This will be, to me, is going to be a very big breakthrough.
I see, thanks for that. So I'm not seeing any further questions coming in, so I think this would probably be a good point to draw this first session to a close. So thank you, Mariano, for giving such comprehensive answers to my questions. I really do appreciate it. And also thank you for giving us your time today, giving such an excellent talk. So before we commence on the second part of today's e-seminar, I believe our organizer, Gavin Pringle, would like to say a few words on in silico world. So I'm going to briefly hand over to you, Gavin, before commencing on the second talk of today.
Yes, thank you very much. I would like to give a short presentation about one of Comp Biomed's sister projects called In Silico World. Let me just make myself presenter. So it's just a very brief talk. It's somewhat of an intermission advert, if you will. So In Silico World is a community of practice, and it's the first community entirely based around in silico medicine. So this would be what Mariano has just been talking about, using some supercomputers to create virtual patients. So this community has three main pillars. The first is expertise, so that it's invitation only. This way we ensure interested experts have access. It's highly collaborative, so we join teams or groups and work together on shared goals, projects, concerns. And it's also a safe space, a pre-competitive space, if you like, where experts from academia and industry, regulatory agencies can all ask for and exchange advice. So there's currently about 450 experts, and it uses Slack to open up discussion between the groups. We have 30 public channels, 9 public channels and 30 channels in total. One particular channel that I'm interested in is in the scalability channel, because this forms part of Comp Biomed's own scalability service. So Comp Biomed is a centre of excellence in computational biomedicine, and we offer a free scalability service. This helps providers of biomedical applications towards either parallelization, so that would be taking your application and making it parallel to run on large high-performance computing. Or if your application already runs in parallel, this service helps you improve its scalability, so you can run either faster or larger simulations. So a key part of this service is the In Silico World Scalability Slack channel. And so if you'd like to join the conversation, or indeed receive free support from Comp Biomed, then the URL here will give you a link to more information and access to the In Silico World directly. And finally, my last slide is just to show off the 450 members. It's quite an extraordinary array from large biomedical companies, including Medtronic, which Mariano mentioned with the pacemaker. There's biomedical small to medium enterprises, independent software vendors, regulatory and standardization bodies, including the FDA, and clinical research institutes from all over Europe. And with that, that's that short advert about our scalability service at Comp Biomed. Now, I think if I can hand it back to Tim, we can talk more about Alia's scalability.
Yes, absolutely. Thank you very much, Gavin. Now, the second talk today will be given by Guillaume Houzeau, who joined the Barcelona Supercomputing Center in 2005 to start the computational fluid dynamics and high-performance computing research efforts in the Department of Computer Applications in Science and Engineering. Now, alongside Mariano, he co-leads a group of 50 researchers whose mission is to develop and apply the multiphysics parallel simulation platform ALIA. His research involves physical modeling, numerical algorithms, code development, and optimization, all driven by the objective of efficient use of supercomputing resources. Now, he's also co-founder of LM Biotech, which, as has already been mentioned today, is a Barcelona Supercomputing Center spin-off company. Now, Guillaume is going to discuss the algorithmic and computational optimizations that are facilitating the multiphysics, multiscale simulations that Mariano introduced earlier. In particular, he will talk about scalability and the strategy behind enabling exascale computation in relation to this work. So I will hand over to you, Guillaume.
Okay, thank you. Thanks a lot, team. Well, first of all, I apologize. I don't have so many videos and nice pictures as Mariano showed, so I hope it won't be too black and white. So just tell me if it's a bit boring for you. But anyway, sorry, I will have to. Okay. To restart. Okay, can you see the presentation?
Yes, that looks perfect.
Okay, so of course this work is a collaboration between a lot of people, some from the department and some from the computer science departments that we have at BSc. So as Mariano said, we are coming from an application department, but at BSc we have this computer science department with who we collaborate a lot to develop all the fancy things we are doing at the department. So the starting point of this talk is these pictures of scalability. So I will come back to this kind of scalability curve all the way through, because this is something that we were asked to show at the beginning some years ago. So the last one is on blue water. So it was done like 5 or 6 years ago, almost 6 years ago. So it's strangely, since that time, we hadn't had the opportunity to run on a bigger computer because usage, well, the machines are more and more occupied, and the access to these computers is very hard, extremely hard in Europe. So this is something we obtained some years ago, and let's say we were quite happy with that kind of curve. But so I will explain how we reach this kind of curve and how we go beyond this kind of scalability. So to attain this good scalability, we worked a lot on MPI, that is for distributed memory. So during, let's say, almost 5 years, we dedicate all our efforts to this. So what this means that we want to be parallel from the beginning to the end of the simulation. Actually, we are not fully parallel because we always have this meshing done as a pre-process and the visualization that is done as post-process. But recently we're integrating the meshing in the parallel process because meshing and post-process are becoming the new bottlenecks that are appearing. So here I showed more or less all the steps of the parallel simulation. So from the reading of the mesh that is done in parallel, we have a redistribution to perform a partitioning in parallel. Then we have redistribution according to this repartitioning. Then we can start solving the equation. And for the post-process, we redistribute once more to have the post-process files in the original numbering, which is very convenient sometimes, not all the time, but this is something we can do. Okay, so as I said before, we were very happy with the speed up, but are we really doing things well? So I will talk beyond scalability and talk about the limitation of scalability. So I will base all my presentation on this performance model that is from POP. So you can download the explanation of this nice performance model. So you have a blue part, well, computational efficiency is divided between a parallel efficiency and computation scalability, a blue and green part. The blue part is an absolute metric. So this is something we can measure really, and you can put numbers on this. On the green side, well, this is a relative one. So you have to always measure with respect to a base case because this is algorithmic dependent and there is no absolute numbers for this. But anyway, this all this model is very nice because it's multiplicative matrix. That means that if you divide one of these things by 2, you divide your computational efficiency by 2. So you have to take care really of everything in these boxes to have a nice algorithm. So during these years, we have worked on all of these boxes, but today I will focus on original things we've been doing during these years because, well, I think that they're original, maybe a bit smarter to tell, and well, hopefully they will be interested. But as I said before, we've been working on all these kind of things. I'm also a bit sorry because some of the examples are not coming from the biomechanics world. Well, Mariano showed a wind farm before. We also work on wind energy, on aerospace. So some of the examples are coming from there, where we have very huge run to carry out. But everything is applicable to anyway to biomechanics. Okay, so I will introduce some. I will be very short on monitoring and tell the importance of monitoring and the 3 things I wanted to talk about. So if I have a lot of slides, so maybe I will have to go very fast. So these are 3 works we've been doing this year. So dynamic resources allocation, multiphysics overload to accelerate multiphysics coupling, and then vectorization and heterogeneous computing, how we envisage it from our point of view. So I will start with monitoring and go back to this performance model. So at BSc we have this TALP library, which is developed at the computer science department, which gives you information about the parallel efficiency. The parallel efficiency is divided between load balance and communication efficiency. Now we'll go to a picture. So on the top you have what we call a trace. So for those who don't know what it is, it tells you how much work and how much communication you are doing with your code and during execution time. So on the x-axis you have time is evolving, and on the vertical axis you have the state of each of the cores that are engaged in your simulation. So blue is work, green is communication, and you can measure a lot of things. Well, not a lot of things, but very important things, which are the time spent doing work and the time spent during doing communication. So we can define 2 important things as shown before, which are the load balance, which tells you how much you balance your work between the different cores, and the communication efficiency, which tells you how much you are communicating. And the parallel efficiency, the real parallel efficiency, is just the load balance multiplied by the communication efficiency. I mentioned before this is a multiplicative metric, so you can see here really what that means. So finally, what you see that the parallel efficiency is the total work, the total time spending to do work divided by the total time spent using the core. So parallel efficiency is just a measure on how well we use the resources. So actually what we would like to have is this kind of trace. So here we have a very nice code that doesn't communicate, and we have a balanced work. But as we all know, we always communicate, and well, this is a very smart sentence from Grop. The easiest way of making software scalable is to make it sequentially inefficient. And for example, one of the nicest way to do it very inefficient is to use a bad compiler on a machine. We have a performance suite, and we are comparing a lot of compilers, and I can tell you that you can have half of the time using one compiler with respect to another. So this has a great impact on the parallel efficiency that you will measure. So it's not just a question of parallel efficiency, but this is important. So here I will go fast. So you have a perfect load balance on the top. You have a perfect load balance, but half of the time is dedicated to communication efficiency. On the top right, you have bad load balance. So this is this kind of things that you want to measure to see how much you are using, how well you are using the resources you have in hands. Okay, so this library that you are using, well, at the end of the code, you have a summary of what you've been doing. So you have communication efficiency measures, load balance, and what is very interesting is that you have information on what kind of loading balance you have. So intranode load balance and internal load balance, because techniques to lower this load imbalance are very different if you are working on intranode or between the different nodes. Okay, so you can, for the intranode, you can use a shared memory mechanism to have a load balance. So I won't talk about that anyway, but this is the kind of information you need. Okay, but what happens in reality? In reality, when we measure parallel efficiency, we don't have this kind of libraries, or it's a bit complex to link maybe, and you don't want to use that. So what you do, well, a normal speed up. So you run your code on 50, on 100, on 200, on 300, and then you normalize the time with respect to 50 cores in this example, and you have your efficiency. And here you say, oh wow, I'm going very well. I have a super linear speed up. I'm going faster with 250, so my code is going very well. So I ran the same, did the same using TALP, and this is what you have for real. So the red curve is what you have measured from this normalized speed up. That this is usually what every people do. For example, when you go to praise, you have to prove that your code is efficient using this strategy. And in reality, it's what's happening is what you have on the right-hand side. So in green, this is the real measure parallel efficiency. So we see that using 250, you thought that you were going well, but you are 20% off the real measure. So this is very important to know what your code is really doing. And this is even worse because it depends on how you normalize your speed up curve. So here I've normalized using 16 cores and 48 cores. So you see that using 16 cores, you're not so bad measuring efficiency. Well, you are underestimating. So what is funny about this example is that the green one is between the red and the blue, and I didn't do it on purpose, so it went out naturally. Okay, so conclusion of that, it's, well, you can use a library. Here I present Vital, but there are many libraries that you can use for this. So this gives you a global diagnosis of your parallel efficiency, if it is good or bad. But sometimes it's not sufficient. So what we usually do, we try to detect problems using this TALP, and then we go for performance analysis. So I will present some very short example on that. So the first example I will present, well, Marianne already talked about it. So it's particle transport inside the respiratory system. So this is a simulation we did in 2000. In this case, well, we have a mix between this 2016 and 2019 because we detected a problem between these 3 years. So this is what I'm going to talk about. So this is the speed up curve, but just for the assembly of the equation. So hopefully in the assembly in finite elements, you don't have communication. So here we were very happy. We said, wow, we have super linear speed up, so we are going very well. And at that time, we didn't have TALP. But if we would have had TALP, the result would have shown that we had a load balance of 0.5. So using the speed up curve, you are completely missing what's happening in your code. So at that time, what we did is a performance analysis. So this is a trace. It was on 512 CPUs. And what we see, so here we have one iteration of the Navier-Stokes equation. So we have the assembly on the bottom left, and then the solver, we have a lot of communication. Communication is shown in orange. And what we observe is that we have 2 subdomains and one which is very bad balance. Actually, this explains this load balance of 0.5 because the maximum is twice the average of computing time. So what was happening there? This mesh is a hybrid mesh, so we have tetra, pyramids, and prisms. Okay, and what happens is that the subdomain with tetra, there is one subdomain with tetrahedra in front of the face, and this is the one that has the highest number of elements. Why? Because we could not really know what was the different weights, the relative weights of tetra with respect to pyramids and prisms. So what Métis was doing is he was putting a lot of tetra in front of the face, and this is why we have one subdomain, one single subdomain that is spending double of the time of the other. So the load balance was due to only one subdomain. Okay, so we are losing half of the time because of this. And what we were really measuring was the scalability of this subdomain, because it wasn't moving. So with this message, I wanted to stress that scalability is okay, but you have to make it well and really understand what's happening, because half of the time, well, maybe for supercomputing center, we don't, well, I would not have to say that, but maybe you don't care that much. But when you're a company, half of the time is half of the price, so, or half of what you can your simulation pays off. Okay, so well, it's nice to go to monitor, and from time to time to go to the doctor to see what's happening in your code. And this is not only the code, this is very simulation dependent, as I will show now in the next presentation. So I will start with this dynamic resource allocation. Tim, could you tell me when I reach 30 minutes, please?
Yes, of course I can.
Okay, thank you, because I don't have any information on that on my screen.
Sure, okay. You're doing fine for now.
Yeah, I have 100 slides left. Okay, so the hypothesis for this work is that, well, the users of supercomputer usually don't know how to select the number of cores to use for their simulation. And, well, one common approach is, well, you get into a supercomputing center and people tell you, okay, you have to use at least 50,000 elements per core, and then you can ensure that you have a, let's say, parallel efficiency of 80%. But usually this parallel efficiency was calculated during this scalability test. Generally, it's false, as I showed at the beginning, and usually it's done on a generic test case, and you don't know exactly what's the result for your example. And yeah, the 4 point is the situation can be even worse, because sometimes you have users that don't have a clue about anything. So they press the button, they choose a certain number of cores without knowing really what the code is doing. And this happens. And I just took a snapshot from you showed Tim and Gavin at the between Mariano's talks and mine. And well, this was for explaining efficiency, but the following of the talk will be about the scalability. It's not simply how fast an application runs. Okay, so I really appreciate this snapshot, because it explains everything that I will tell during this talk. Okay, so this what we've been working on. So this work is a proof of concept, because this is something you cannot implement on any supercomputer. But we wanted to demonstrate that it's possible to control the parallel efficiency at runtime of the code that are running on a supercomputer. Okay, so we present a methodology to automatically adapt at runtime the resources allocated to a simulation. We'll base this on the measure of communication efficiency, and then we will ask the batch system to reduce or expand the resources to execute the code. Okay, and this is very important, and this will be done remaining inside the same job, so that the user press the button, can go to bed, and the day after you have an efficient simulation. So this was the objective of this work. So for this, the 3 ingredients are ALIA, the finite element code that Marino presented before. We have this TALP library to measure parallel efficiency, and then we have COMS that will deal with the workflow and that will talk with the batch systems. Okay, so the methodology, which is a picture to describe what we are doing. So we have policies for BSC operations. Gavin says 70%. Here at BSC, they used to say between 70 and 80%. So hoping it's a real measure. So in this case, it will, because we are talking to TALP. So we ask TALP if we are efficient, and TALP tells us, okay, you have a good parallel efficiency, bad parallel efficiency. If the parallel efficiency is good, maybe we can ask for more resources. If it's bad, we should ask for less resources, because we are under using the resources. So this is a bad thing for the operations department, because we are losing money. So what we do then, we restart. We ask COMS to expand or reduce the resources, and I restart with a new amount of resources. So this is a generic example that I will use to show the results of what we've been doing. So this is a Navier-Stokes solver, implicit one. This is quite coarse mesh, but it was suitable for the computer we have in hand to do these kind of things, because we really need to control slurm, and it's not in some of the supercomputers you're not allowed to do that. But with one of our supercomputer at BSc, we can do that. So this is what we have to do. So ARIA is talking to TALP. I'll go through that, and TALP gives you a measure of load balance and communication efficiency. Okay, so I remember here what is communication efficiency, which is the time spent communicating, more or less. Okay, so this is to summarize the interaction with TALP, with COMS. So COMS is the workflow. So we are inside the slurm job, and COMS, according to what ARIA requires, if we need more or less resources, it asks for, it requests more resources or less resources to the batch system, and the batch system extends or reduces the allocation for this job. So then the mechanism is COMS tells ARIA, we send a seek term to ARIA, so ARIA receives a seek term when the resources are available. If we require more, okay, maybe it will take more time, but once it's available, COMS will tell ARIA to stop, so ARIA write the restart files in the original configuration and start with the new resources. So I repeat, the important thing here is not to go out of the job. So we'll go through that. Just a small, well, this has not really to do with this work, but just for you to know that the system noise that we have on all supercomputers affects the time to solution. Okay, so for example, for this example, I've run using 14 cores per node, 15 and 16. So we see that the communication efficiency is very affected by the noise on the system. And this has a repercussion on the time that you have on the left. So here we see that using 14 cores per node, 14 core per node, we have a quite stable time to solution. So in the following, we will use or 14 or 15. Okay, so the target criteria, as said before, we want to use communication efficiency. So the user will prescribe a range. Let's say I want to be between 70 and 80. So we define, using this range, we define the target range, which is the half of this range, half of the mean and the max. And so what we do, we compute computation efficiency using TALP at runtime. We know that we have n cores, and then if we are not in the range, what we are going to do is to estimate how many cores we should use to be in the range, and then requires this number of cores to COMS. Okay, so I will go through that because we have to make some hypotheses. So at the end, we end up with this formula which tells you, according to what you are using, you are running on n cores, you have measured CE computation efficiency, and your target run is you want to have a prescribed communication efficiency, and you have to estimate the new number of cores. So this is the formula we are using, and this worked pretty well. So I will go through that. So apart from this range, we have to define some parameters to define the simulation. We start after a certain number of time steps to avoid the warm up of the simulation. We have to prescribe initial number of cores for sure, a frequency during which we are accumulating communication efficiency, because we cannot do it at each time step. So let's say, well, if I give some typical values, mean and max number of cores. Of course, your system is limited, so you have to limit the number of cores admissible to your simulation. And also we will control the rate of change, because the formula is not perfect. So we won't let the simulation to change according to the formula without limiting a bit the rate of change of the number of cores. So these are a few parameters. So here, what I'm showing is two kind of simulations. So the target, on the left-hand side, you have the communication efficiency we measure. On the x-axis, you have the time steps. The red shadow zone is the target communication efficiency. So on the left-hand side, it's between 0.9 and 0.92. And then you see that the simulation, how the simulation is evolving. So you see that the number of cores, the blue line, is increasing because we are requiring more and more cores to COMS, because the communication efficiency is higher than the target one. So until you get your final target one. So we have here 3 iterations, and we see that in 3 iterations we reach the target communication efficiency. So at that time, after 40 time steps, we know that we are efficient between 0.9 and 0.92, and this is a real measure. On the right, well, it's the opposite situation. We started with a very high, we are asking for a very high communication efficiency. So the number of cores to reach this efficiency should be much below than in the first case. Okay, so we see here at the end that in 2 iterations we reach the target communication efficiency using 20 cores. So this is very stable, and I can assure you that this is not trying to converge. It really converges to the solution quite quickly. Okay, then what we did here is to decrease the communication efficiency. So this is easily done by increasing the number of iteration of the solvers. So here what I wanted to check is that if I use a higher rate of change, if simulation is not blowing. So we see that in both cases with rate of change of 1.5 and 3, we reach the optimum, well, the range in 3 steps. So very fast, in 50 time steps. We are okay, and the simulation is stable, and we have the desired communication efficiency. Then what I did is to increase linearly the number of iterations of the solver to see if the algorithm was able to react to a change of communication pattern during the simulation. So this is exactly what we obtain on the right hand side. So we see that communication efficiency is decreasing because the number of solver iterations are increasing, and we see that the number of cores is decreasing until gradually until well, the simulation is more or less stable. Okay, I will not present this because I will never finish. Okay, so what we have proposed in this conceptual work, I repeat, this is a proof of concept because you need to be able to control the batch system of your supercomputers, and you need some special rights to do this. And for example, on Mare Nostrum 4, it's not possible, so we have to use another supercomputer. But if you have access to this, then we have a way to ensure a minimum computational efficiency to a simulation. And this is not complex. It's just to be able to measure the efficiency and to communicate to the workflow manager. Okay, and this computational efficiency is based on real-time measures, so it's a real one. And this is something we discovered afterwards, is that as a side effect, this methodology is resilient because we always stay in the same job. So even if the simulation crashes because one node has crashed, well, it will try to restart all the time. So we discovered that. So this is a side effect. So it's a nice thing to have a resilient simulation. So what we want to study, of course, is, well, these cases are, let's say, not that complex because it's only Navier-Stokes equation. We would like to know what happens with cases with bad load balance, because these cases had not that bad load balance, but it was almost constant a long time, independent of the number of cores. And also we could think of other criteria to choose the target, to select the number of nodes. For example, the time to solution, okay, regardless the communication efficiency. So we have a way to control the number of cores to simulation and to restart at runtime and adapt to this. So this is more or less what I wanted to say about this. And I will go, sorry, no transition. I will go to the next talk. So this is something I already presented last year, but I find it so smart that I want to insist on this, and I will give some new results. So I will go fast maybe on the presentation. Tim, how am I going?
You're just shy of half an hour.
Half an hour, good.
Yes.
Okay, I'm half of the talk. Okay, so what we want here is to solve multiphysics problems. So I give the example: fluid heat transfer, conjugated transfer, fluid structure interaction. And in the case of, well, the examples I will give, it's electrophysiology. So maybe I should have put electrophysiology here to be more representative. But anyway, it goes to any kind of multiphysics problem. Okay, so what the context is multi-cut coupling. So this is something we use a lot because it's a very flexible way of coupling physics, because you can use different resolutions, you can use different algorithms to couple them, and you don't lose time, as I will show you just afterwards. So on the bottom left, well, this is the way how we invoke a multi-cut coupling inside an MPI, same MPI communicator. Okay, so I will talk about basic coupling algorithm. And then what I want to show is, well, to compare algorithmic performance and computational performance of Jacobi and Gauss-Seidel couplings. So you'll see that it's quite very interesting. And then a way to enhance the Gauss-Seidel, because we know that Gauss-Seidel is algorithmically better algorithm than Jacobi. And I will show two examples, well, three examples to illustrate the performance of the proposed methodology. Okay, so the performance indicator we are using for algorithmic, it will be based on robustness of the algorithm and the convergence rate. And robustness is, well, sensitivity to convergence, to the external parameters to reach convergence. And regarding computational performance, we're going to use CPU time to solution and computational efficiency. So I will try to go a bit fast on this. Also very important that all the algorithms that Mariano presented are based on algebraic at the algebraic level. So this is very convenient because you don't have to worry about how to compute integrals. You have everything in your matrices, so it's algebraic level is very convenient. So this is what we use here. So I will very quickly explain the concept for just to be self-consistent. So okay, so we have a problem, AU equal B, and we first renumber the unknowns between the subdomain 1, the subdomain 2, and the interface node. So this is the middle equation, and this is of course equivalent, and the second one can be obtained by renumbering the first one. And then we just duplicate the unknowns on the interface. So we have introduced an additional unknowns. Okay, we call it U gamma 1 and U gamma 2. And the equation you see on the bottom is completely equivalent to the second one. What we did here is just to have a split between the solution on one subdomain and the other subdomain. Now, if we rearrange some of the terms, we realize that this is just a Dirichlet-Neumann coupling. So we have the solution on two subdomains, and they are coupled through a Dirichlet condition, where you see on the top, and a Neumann condition. Well, this is Neumann condition at algebraic level. If you would do that at the continuous level, you would have to compute an integral, but here it's what I said before, it's very convenient to work on the algebraic level. So this system is completely equivalent to the first one. So what can we do with that? So this is a monolithic one. We can have the solution of this in, well, one iteration, because this is equivalent to the first one. So Gauss-Seidel and Jacobi are just the previous equations, put in some index, iterative index k. Okay, and from this we can obtain a parallel one, which is a Jacobi one, and with the Jacobi one we would solve the two problems using the boundary condition computed from the previous iteration. So this would be parallel, both can run at the same time, and taking m equal to 1, we obtain the sequential or Gauss-Seidel coupling. It's called sequential because we have to run first the first problem and then solve the second problem using the condition of the first problem. So this is a very generic way of drawing a Gauss-Seidel coupling algorithm between two physics. It doesn't have to be the same physics at all, because fluid structure interaction can be represented the same way. Okay, and well, I will not present it here, but this can be extended to non-matching meshes very, very easily. Well, very easily, not that much. Okay, so to present the algorithmic performance to compare Jacobi and Gauss-Seidel, I will introduce a domain decomposition method for a very simple problem in 1D. It's just to present some theoretical convergence results, but I won't talk a lot about that. So because in 1D everything is easy, but the results in 1D are very representative of what can happen in 3D. So we are going to solve an advection diffusion reaction equation between in a certain range, minus L1 and L2, with an advection which can be positive and negative. Okay, so for this, we are going to use domain decomposition method. So this is a generic way of presenting a Dirichlet domain decomposition method using the Jacobi or the Gauss-Seidel algorithm. So you see that here that we introduce overlap because it's, I said, generic. So overlap always helps to converge, but well, in all the examples I represent, we don't have overlap, but this is for generality. So at the algebraic level, the algorithm I was presenting before was just a Dirichlet-Neumann method. Okay, and then I will introduce an iteration relaxation parameter for these equations. Actually, you could have two, but this can be simplified using just one relaxation parameter. It's completely equivalent, so I will just manage one relaxation parameter. Okay, so on this, we do perform an error analysis and we compute the rate of convergence. So we realize that the convergence depends, of course, on everything, on the relative sizes of the subdomains, on the sign and magnitudes of the advection field, on the type of coupling, on the overlap, if we choose Jacobi Gauss-Seidel, and relaxation. But this is saying that everything depends on everything. It's a bit stupid, but this is really the case, and we can compute this dependence. I will go fast on that. What is important here is what we said at the beginning, the robustness and the kind of convergence we have. So here, if you have sensitivity to relaxation, I will tell you, you will see very quickly what that means. So we have a good sensitivity for Gauss-Seidel and a bad sensitivity for Jacobi. We will see in a while what that means. And in terms of convergence, well, depending on the algorithm, but more or less the rate of convergence of the Jacobi is the square root of that of Gauss-Seidel. So what does that mean? Simply, well, it's very easy to see that if you have the square of one convergence, the number of iterations to reach a certain residual is the double. So to converge, the Jacobi is going twice slower than the Gauss-Seidel. So this is a very, very important fact. So, well, it's not verified in any cases, but in this 1D case, this is really what we obtain. So what I will compare now is, let's say that rho sec is the rate of convergence of the unrelaxed methods for Dirichlet-Neumann. In this case, we are using Dirichlet-Neumann. Okay, so we can compute the rates of convergence of the relaxed version as a function of rho sec. And rho sec will depend on as I said before, on the advection, on the relative length of the subdomains, on all the physical parameters of the equation. So this is what we obtain. So rho equal to 0, it's optimum convergence. We converge in one iteration. So there's always relaxation parameter that enables us to converge in one iteration. So below 1, we converge, and above 1, we don't converge. So we have the Jacobi on the left-hand side and the Gauss-Seidel on the right. So it seems a priori that the Jacobi has a more extensive range of relaxation parameter to reach convergence, but this is not important because if you put a line in one, it's exactly the same, just symmetric. But what is very important is if you see around the optimum, which is the lower part of this curve, around the Gauss-Seidel, the range is much broader. This means that if we move a bit the relaxation parameter around the optimum, the rate of convergence will change slower. So this means less sensitivity to the relaxation parameter. So this is a very nice property of Gauss-Seidel. Jacobi, we see that we have a very straight. If we move a bit the relaxation parameter, maybe we start to diverge. So to summarize, the parallelism of the Jacobi is achieved at the expense of a lower stability and robustness. So this is just what I've shown, that we have this sensitivity around the optimum, and we have a slower convergence. Actually, in the case I presented before, it's double of iterations to reach convergence. So now you've just seen the algorithmic performance. Now we will go into the computational one. Okay, so I will go. There is a lot of slides here. So we define efficiency. So this is exactly the same as before, as the ratio between the used resources and the available ones. Okay, so bit of definition, we have two physics that we want to couple, and we have to decide how many cores will I use for the physics 1, so it's P1, and how many cores I will use for P2. So this is something you have to decide at the beginning of your simulation. So you have to know how your physics behaves, how many elements, how the load, the workload will be distributed between the different physics. If the solver of one physics is going slower, well, it's not an easy task to, and it's not an easy task to know if you are doing things well. Okay, so usually what we do, well, I will go through that. Once we have decided, well, this is an illustration of both coupling. So Jacobi, both physics are running at the same time, and Gauss-Seidel, one is running before the other. So it's like a trace, okay, very, very schematic trace. And so we see also so each physics has its color, and in yellow, you can see the communication when we have to exchange these boundary conditions between the different physics. Okay, so we'll make some few assumptions. We will neglect communications and assume perfect strong scalability, which means that each physics is strongly scalable. Okay, so we'll do some definition. T small t I will be the time to run physics I on one single core. And as we assume perfect scalability, we can compute the time to run on PI cores. And we derive the performance model. So it's very, very stupid. You can see the time. It's more or less the same, except that Jacobi has a max and Gauss-Seidel is the sum. Okay, because in the Jacobi we are running at the same time, and the Gauss-Seidel we have to wait for one physics to finish to start the second physics. So this is the main difference between the two timings. And the efficiency, well, it's just the time we spend using the resources. Okay, so it's blue plus white divided by all the colors. So here we have the formula for the Jacobi, and we have the formula for the Gauss-Seidel. So with the formula, we cannot see anything, so we have to go into some figures. For the following, we'll assume that one of the physics is greater than the cost of one physics is greater than the other. And we find P, the ratio between the different number of processors, and T, the ratio between time. So we can rewrite everything in terms of T and P. So we have a nice formula that we cannot conclude anything, so we have to go to some figures. So this is the efficiency ratio between the Gauss-Seidel and the Jacobi. We know that, of course, the Gauss-Seidel will be less efficient because it's a sequential. We are sequentializing the run because one physics should run after the other. So we can see here that the efficiency ratio is between 0.5 and 1. So we know that at least we are going twice worse with the Gauss-Seidel, and maybe we can reach 1. So here what we are seeing, so it's for different T. So you remember that T is the ratio between the time to run one physics on one core and the time between another physics. So on the left, it's the easiest to understand. If the same physics have the same weight, we know that the Jacobi, by dividing the number of processors by 2 for each physics, we are going to have an efficiency of 1, of course, because they are synchronized and they all use the same resources because they all have the same workload. And on the contrary, it's the worst case for the Gauss-Seidel. Okay, so the efficiency, the maximum efficiency we can reach in this case is 0.5 for the Gauss-Seidel. But this is the worst one we can reach in general. So if we change the weight and we see how if we move the redistribution of the processor, the situation is quite different. And on the right, we see another extreme that one physics is almost nothing, and we see that they are very near, that the Gauss-Seidel is very near to the Jacobi. But what is very interesting here is that we observe exactly what we observe in the case of the algorithmic performance. The sensitivity around the optimum is much less in the Gauss-Seidel than in the Jacobi. This means that in the Jacobi, if you miss the number of cores you have to select for one physics or for the other, your efficiency will go down very quickly. And this is not the case of the Gauss-Seidel. We see that around the optimum, the Gauss-Seidel is quite smooth. So this is another very interesting property. So this is what I'm saying here. The Gauss-Seidel, the choice for P1 and P2, how you distribute your physics in your machine, is less critical for Gauss-Seidel with respect to Jacobi. So we will do some very simple tests. So this is just the temperature equation. So using this Dirichlet-Neumann at the algebraic level, is 500,000 elements for each of the physics. And what I wanted to test is if the formula is okay. So this is a trace for Jacobi, and trace for Gauss-Seidel. Okay, so I missed on purpose the number of CPUs to distribute, and you can see that the theoretical value are very near from the measurement we did on this trace. So formula are okay. And as a summary, we have that at the algorithmic point of view, Jacobi is a bad algorithm because convergence is slower and it's less robust than the Gauss-Seidel. But at the computational level, of course, Jacobi is parallel, so we are in principle using all the resources, and this is not the case of the Gauss-Seidel because we are sequentializing the simulation. So here we have a very important question. Who do you prefer to make happy, the system manager of the supercomputer or the engineer that uses your code? So the proposition we have here is to make happy both of them and feel good so that we are not angry at anyone. So we'll try to be algorithmically and computationally efficient. Okay, so we'll base all the hypotheses on the Gauss-Seidel. How to make the Gauss-Seidel more efficient? Because with the Jacobi, we don't want to change the algorithm. There's very few we can do. We can change the relaxation parameter, but this is anything. In any case, it would be less robust, and its sensitivity to relaxation is too high. So we want to use Gauss-Seidel and make it efficient. Okay, so what we can do, what we can think of, is to overload the resources. It means that we do an oversubscription, and we have P cores, and we run the 2 physics on the P cores because, of course, when you're running one physics, the other is waiting. So maybe we can overload the resources. So what happens is, oh, something is missing here. Okay. So this is how we do it with IMP or with OpenMPI. I'll go through that. So what happens in practice is, okay, you have the first physics running. So yeah, we'll go to the other one. We have the first physics running, and then it stops. So it sends its message to the second physics. So the second physics starts its iterating. But what happens? The first physics is waiting for the physics 2 to finish. So physics 1 is inside an MPI wait because it's waiting for physics 2 to finish its iteration. And this MPI waits consumes a lot of resources. Okay, so what we can do is to introduce a barrier to calm down MPI. So here we use DLB, which I presented DLB before. It's the same library that has TALP inside, with which you can measure parallel efficiency. So with this barrier, we just what we did just to calm down MPI, to say to MPI, okay, don't check if you are receiving messages all the time. So if this works, this means that we are using all the resources. So what I've done here is to see as a function of P and T. Remember, P is how we distribute the CPUs between the cores between the different physics, and T is the relative load of the physics. And this is the speed up we can obtain with respect to the normal Gauss-Seidel. So if this works, then we can be much more efficient at any place of P and T because you don't even have to choose P. Okay, so this is the same as before, but this is compared to Jacobi for different values of T. So on the left-hand side, it's the work is distributed well distributed between the 2 physics. So of course we know that we will use all the resources if the barrier works. Okay, and you see that the Jacobi, you have of course this optimum at 0.5, but remember that okay, this is computational efficiency, but you know that you are converging twice slower with the Jacobi. So if we can reach what we are showing here, so we know that we are going twice faster than the Jacobi. Okay, so we have 2 ways of overloading. What I'm going to present now, we can overload or oversubscribe without the barrier. So this is what I explained. We have this MPI weight that can consume resources. So we'll see at what extent it is the case. And we can overload with this barrier to calm down MPI. So I will present now the results. Okay, so these are numerical experiments. So these are the run we have used. Okay, so here we have a trace of the Jacobi. So it's just a 10, 20 iteration, I think, I've run here. So we see that the Jacobi on the top, the Gauss-Seidel on the top right. Of course, the Gauss-Seidel is, for this case, when we have well-distributed workload between the different physics, the time for Jacobi the efficiency for Jacobi is half of that of, for Gauss-Seidel is half of that of Jacobi. If we overload the resources, we see that we have a negative speedup. Okay, so the simulation is lasting too much. So this is due to the MPI consuming resources. And if we use this barrier to count down MPI, we have a speedup of 1.3. But why do we have this? Because we have very few number of elements per course in this case. So we are losing parallelism. And this is not the real speedup. So this is the wrong speedup. So we are losing efficiency because, of course, we are using double of resources for each physics. So you need to be scalable at least for the number of cores you are dedicating to each physics. So let's go to a larger scale. So what we did, okay, instead of 500K elements, we are using now 4 million elements. Okay, so this is what happens. And now by overloading the resources using the barrier, we have a speedup of 1.6. But this is not perfect. We would like to, we said before, we would like to be twice faster. So we want to reach a speedup of 2. But anyway, in this case, parallel efficiency just with respect to Gauss-Seidel, it's not perfect, but remember that Gauss-Seidel is converging twice faster. So in this case, we would earn some time to reach a solution. And not that efficient, but we would go faster. So now what I've done is to try IMPI, because before we were using OpenMPI. And what we see here is very different situation. Okay, so we see that the oversubscription with IMPI when using this barrier is almost perfect. We have a speed up of 1.97. This means that Gauss-Seidel is almost as efficient as the Jacobi in this case. And using the same amount of resources, we know that we will converge twice faster. So this is really what we were looking at. Okay, so these were these were tools. Now we are going to a real example of electromechanics, fluid model. So we'll go very fast. So it's electrophysiology, very complex coupling. Okay, so we are running the CFD on the blue domain and electrophysiology on the red one. And we are doing fluid structure interaction between the fluid and the solid. Okay, so this picture was shown by Mariano before. In this case, the Jacobi does not converge, so we don't have any choice. We have to use the Gauss-Seidel. So we've tried just as before. So this is the trace of the problem. So using exclusive resources, meaning that we distribute between fluid and solid the resources. Well, this is a reference measure. If we overload without the barrier, we don't have speed up, so we are spending the same time solving the problem. But if we use the barrier, we have a speed up of 2.05. So we have the perfect acceleration that we are reaching. We are using all the resources, and if the Jacobi would converge, we would reach exactly the solution in half of the time under Jacobi. Okay, now what we have done is to run the same problem on a larger mesh. So it's 3 million for the fluid and almost 4 million for the solid. Okay, so in this case, you have to make sure when you are using several nodes, you have to make sure that in each node you are mixing fluid and solid, because if you want to overlap computation, you need to work both physics on all the nodes. Okay, so this is the results using the exclusive and using this overload with barrier, and the speed up in this case is 2. So the conclusion of that is we have a way to make the Gauss-Seidel as computationally efficient as the Jacobi. It means that we are using all the resources. So using the same amount of resources of the Jacobi, we can be as efficient. But we know that we are going twice fast. So we have the two advantages of the Gauss-Seidel. We are going twice faster, and we are 100% efficient by using all the resources of the node by this oversubscription. So this is a very nice conclusion. What you could think of also is okay, I can use half of the resources, and I will spend this, and I will spend the same time to get to the solution. Because if I use half of the resources, but I know that I go twice faster, at the end I will go, I will reach the same solution. Well, if Jacobi converges in the same, using the same computational time. Okay, so this is for this example, and I will present another application, which is multi-resolution. Okay, so this is also, well, this is electrophysiology, but here we don't have a fluid mechanics. But we wanted to do is to have a higher resolution for the electrophysiology and a lower one for the solid mechanics. So it's a multi-code also, and it's a Jacobi coupling. Well, actually, in this case, it's just a one-way coupling, but we have exactly the same problem. So what we have done is to apply the previous strategy for solving this problem, and this is the result we're obtaining. So it's exactly the same as before. Using exclusive resources, we have a normalized speedup of 1, and using the overloaded resources, this means that we are using the same number of cores, but in this case, all the cores for both physics, we have a speedup of 2. So just like before, we can be as efficient as a Jacobi or exclusive resources paradigm to run this multiphysics problem. Tim, how much time do you have?
I've made that about 5 minutes or so.
Whoa. Okay.
You can run, well, you can go for how many more slides do you reckon you have?
Well, okay. So maybe I will stop because I have a full presentation now for another topic, but I will stop. So the conclusion, well, we can make the Gauss seidel as computationally efficient as Jacobi. As a side effect, by overloading, you have to think less of how you have to distribute the physics. When you're using exclusive, you have to think, how much resources do I dedicate to this physics, and how much resources to the other one? In this case, you use all the resources. Of course, for this to work, the problem should have more or less the same, should be scalable on all the resources you want. If you have a very different problem and one is very fast and the other is very slow, maybe this doesn't make sense. But usually, for this multiphysics problem we are running, it's almost always the case. So we spend the same time on one physics and on the other. Okay, so, well, apart from this, we have to consider if we have synchronized kernels after this, on this overlap, then we may have a problem like post-process, because both physics will be fighting to do their post-process because they are using the same resources. So this could be a problem. And of course, as I said before, we need sufficient parallelism on both physics to have this works. The barrier, of course, is very important. If we don't use the barrier, we just overload. We can even lose a lot of time. And finally, if you're using several nodes of the supercomputer, you have to make sure that both physics are running on the same nodes. I think I will have to stop, because if not, I'm going to kill people. Or what do you think?
Thank you very much, Guillaume. Yeah, I think this would probably be a good time to go to the Q&A session. You managed to cover a lot of material in a pretty short period of time, so
yeah, I didn't know I spent so much time on that.
No, thank you very much. I feel as though you could probably devote a whole lecture series to this topic. But just as before, a reminder to the audience that if you have any questions, please go ahead and write them in the questions tab so that I can read them out for you. And so, whilst you're all gathering your thoughts, I'd like to ask you a couple. Questions, Guillaume. So, with respect to the CPU/GPU implementation, how do you go about balancing the universality of the code and the computational efficiency?
Well, we don't. Well, I was about to go more in detail on that in the last presentation, but this is something we've been fighting, and it's very people dependent, because what we don't like is to have people recode everything all the time, because it's a lack of time. It's a loss of time, of course, because we're not free people, and And you have to do this from time to time. So at the end, you lose a lot of time. But on the other hand, we know that using techniques like we are using OpenACC for heterogeneous computing, we know that we're not as efficient as if we use CUDA. So between one extreme and the other, we have a lot of fights in the department because people want to go fast, but at the expense of being very specific. And then they are the only one that can use their implementation. So, and we don't want people to have their own code because we have to maintain this. You have to make sure it works. So this is a very hard question for us.
Sure, I appreciate that. So with so many options for setting up your problem, for compiling, for running the code, how do you ensure that the users don't miss the optimization that you've been working on?
Well, also this is it's a nightmare because people have very bad habits because we have at hand great supercomputers and they don't realize that well, to go twice slower, it's cost twice electricity, and the electricity bill, well, Mariano showed this before, well, it's quite a lot, and Mare Nostrum is not the biggest one. I don't even want to know what was going to happen with the next Mare Nostrum. And it's very hard to make them understand that this is important, because it's not just a question of scalability. They usually publish the paper, they put the scalability curve, and they're very happy with that. But that doesn't mean, I mean, this Gauss-Seidel is perfectly scalable, but you're losing half of the resources. So it's completely stupid. And actually the support at BSc, it doesn't happen too much, but sometimes they directly close your simulation. If they see you're not efficient, they shut down your simulation. So this, as I told you, it doesn't happen because they have to check every run and every job running on the supercomputer. They don't do this, but sometimes it has happened. It has happened in the past. And it's a very bad habit of people of not making sure they are efficient. And of course, you have to include this automatically in the code, because if not, if compilation is too complex, you have to use plenty of libraries to make this works. They won't use it. For example, this buyer, DLB buyer, it's not even an option in the code. You have to run with it because, well, we want this to be used.
Right, I see what you mean. Okay. I don't think we've had any questions yet from the audience. So maybe I'll ask one more question. And this is something that Mariano kind of touched upon very briefly. But in that you have quite a unique setup being a supercomputing company yourselves, how's that kind of affected the development of your codes, for example? Have you noticed the benefits from having that access so readily available?
Sorry, you're asking to me or to Mariano?
Well, I suppose to either, but it's more posing it towards you, Guillaume.
I think Mariano should answer.
Okay.
Sorry, can you repeat him?
It's something that you mentioned very briefly, Mariano, in that because you are within a supercomputing center, you mentioned that is not, that isn't that commonplace, and so how has that affected your ability to develop codes, for example? Have you really noticed a benefit from that?
Yes, the fact is that if you make your code, it is very important. Something that Guillaume said is that if you are a company, if you are in a research center, public research center, sometimes you forgot about the energy consumption or the amount of resources that you use, because, well, the resources are there and you think that they are just for free and coming from the space.
Right,
but if you are in a company and you have to rely on the resources that you use, code efficiency is absolutely important. So if you want to, and our model is on a pay-per-use basis, so it is not like I give you a license and you do what you can. So that's why it is very important for us. But then when you, at the moment that you start asking for resources, even if you work in a public research center, when you start asking for resources in a different computer than yours, Like for instance, in CombioMed, we have allocations for, I don't know, let's say, suppose 90,000 hours computing time. Then it's what I can do with 90,000. So if I can do double, then it's doubly better. So that's why I think it is, when you work in a supercomputing center like ours, there is this very stringent idea of the efficiency of it is not just parallelized, it is parallelized efficiently. So
Right,
that's why it to me is very important.
Yes, it's sounding like a bit of a double-edged sword, actually. In that, on the one hand, you have the access there, but then on the other, you're having to think about the economics of your codes. But then again, I suppose that also then forces you to be making sure that your codes are as efficient as possible when there's some sort of monetary incentive there as well.
Yes, and also, and I think that this is something that I will say something that it is not completely politically correct, is that sometimes Europe just, they just put the computer, the exascale computer for people to use, but without, and asking people that can use it, but without asking if they can use it efficiently.
Right.
And things are going to get hot when they start seeing the amount of electricity consumption. It is not just running just for running, it's running efficiently.
Absolutely. Yes, no, it is an absolutely very important consideration. Okay, so
sorry. No, just wanted to add, if you see this scalability curve, if you don't measure it correctly, it's nonsense. It doesn't tell you anything. So it's, I think that, well, we should revise our way of measuring parallel efficiency.
Right, no, absolutely. So it's not looking like there are any questions coming through. So I'm thinking this is probably a good time to draw the session to a close. So thank you very much to both of our speakers for giving us their time today. I very much enjoyed it, and I'm sure the audience did too. Just one final reminder that this e-seminar will be available on the CompBiomed YouTube channel and website, which is accessible via this link that's being shown on screen currently. And finally, thank you very much to everyone in the audience for attending, and I hope that you all enjoy the rest of your day.
Thank you guys.
Thank you.
Bye.
Thank you both.